Hello, good evening, candidates. I'm Rithu SA. So today, as part of our curriculum, we're going to deal something that is very important for a health professional. Okay, so rather than giving a very conventional introduction, why not start with an activity? So let's do an activity and then we'll blend into the topic. Ready? So for that activity, I want you to divide into groups. So let's make group of 3. Okay? Yeah, I'll give you 5 seconds. You can form the group. 1, 2, 3, 4, 5. Yes, well done. Great. So now you are in a group, and since we are all health professional, I'm going to give you a very simple task. We're going to create a tableau. Okay, a very simple tableau. So do you want me to explain what a tableau is? Tableaus are like still images. Okay, you can create figures. For example, I can create a tableau of a flower by showing like this. If I show like this, I almost look like a flower. So these are tableaus. So in groups, I want you to create tableaus. Okay, so the topic for the tableau is actually a health professional setting. So I have given you the topic, a health professional settings. You can think about any settings that comes to your mind when you think about profession related to healthcare. Okay, so it can be anything. For example, you can create situation of a doctor examining a patient. Okay, you can also create the situation, or the tableau can look like something of a nurse giving care for a patient. Okay, or you can also enact as if you are in an OT and you're operating someone. That's also possible. So anything that comes to your mind, you can create in the next 5 seconds. You have 5 seconds for planning, and after the 5 seconds, I'll give you 10 minutes to execute the tableau. So here is your 5 seconds to decide what are you going to create. So discuss among your team members and make sure it's in English and decide what is the image that you're going to create. Okay, let's open a quick discussion in 5 seconds. 1, 2, 3, 4, 5. There you go. So is there anyone who has not decided yet? Okay, that's fine. That's perfect. So everybody has got the topic. So now it's time for you to create a tableau. You can recreate the image that came to your mind using your team members. You can use properties, or you can imagine as if something is with you. So this is your 10 minutes. Okay, so the time is out. Oh, it's wonderful to see you all in this figures. Very good. So now let's observe each other. And what is your setting? Yeah, it's almost like, treating a patient, right? We have operation theaters over here. And now I have a question. All these are physical settings, right? That means in a hospital, in a clinic. So these are all physical settings. And now I have a point to ask you. Is it only physical setting, or is it only the bedside? That is it only place that the patient is meeting with the healthcare professional? Let's think about that, and then let's come back to your seats. Okay, so now you're all back here. I would take this moment to appreciate you for your spontaneity and for your willingness to create that tableau. So I would like to give you a huge round of applause for that. Wonderful. Now let's come back to the topic. As I asked, all the tableaus that were created was of a physical setting. I'd like you to bring your attention into something different. What about a setting that is connected to an optical fiber? Why don't a telephonic conversation between a healthcare professional and a patient or a caretaker has not gone through your mind? That also is healthcare. Most often for making appointments, or sometimes for the clarification of doubts regarding the medications, maybe of management, we often call professionals, right? So that is the module that we are going to handle today. It is actually called the virtual module. That means it's not often the physical setting that people meet each other. There is something called an auditory handshake. That means the situation where you are addressing a patient or a caretaker over the phone. So our module today is based on that, and let's name our session Auditory Handshake. So welcome to the module of Auditory Handshake. Okay, so as discussed, I would like you to ask why or what are the contexts that most often patients, their caretakers, or their bystanders are calling a health center or a clinic or a professional. Yeah, exactly. So there are many situations like that. Yeah. So most often it is not necessary that it is always for management. It's not always for an inquiry. It is basically for certainty, right? There is something called certainty that the voice gives to the patient. That means when somebody is giving a call, and if you're attending a call as a health professional, they're not always talking to you. So let's take an example for what I said. Imagine that you have bought a phone of the company Samsung. Okay, and you have some doubts related to the settings and you have decided to call to the Samsung customer care. And imagine a girl named Sandra has picked up your call, and when you say hello and you listen a hello and a sound from them, are you imagining the face of Sandra over there? Do you know Sandra? No. So when we talk to Sandra, whom are we actually talking to? We know we are talking to Samsung, right? For example, if you have ever visited a supermarket, let's say Lulu hypermarket, and you have a complaint related to the product you purchased and you are calling to the customer care number, are you talking to that particular person? No. You are talking to that brand. So, especially in healthcare setting where people give you a call or people initiate a telephonic conversation because they need assurance, because they need certainty. And when you talk to them, it is not always you in person who talks to them, you become the brand. So that is where today's session is most important. So in today's session, we're going to analyze the importance of a telephonic conversation and how can we mend ourselves to be a better communicator. Ready? Yes. So let's begin the first session. But why not we do some kind of a meditation? Ready? So I want everybody to close your eyes and I'll give you 2 sentences. Okay? And I'll give you 2 sentences. Those are same sentences, but crafted differently. Okay? You have to listen to it and tell me which one is better. Okay? So I would love if everybody close your eyes. Please close your eyes. Yes, wonderful. And now imagine yourself as a caretaker or a bystander who is giving a telephonic call or initiating a conversation over telephone to a healthcare clinic or a healthcare professional. Okay, now imagine yourself as dialing the number. Okay, great. And the phone is ringing. And now you listen to that call. Okay? And the first sentence is, hello, this is ABC Clinic. No, the doctor is currently in consultation. I can schedule you for 4 p.m. Is that okay? This is the first sentence that you hear. Now, second context. So you have dialed again to a clinic named B. Okay? So you're dialing the number, the phone is ringing, and the executive picked up the call. And here is a call. Hello, this is Clinic ABC. How may I help you? Oh, I'm so sorry to inform you that the doctor is currently in consultation. However, I can certainly schedule you for 4 p.m. Is that okay, ma'am? Wow, that's great. Then I'll definitely make an appointment. Okay, ma'am. Thank you for calling. Okay, that's Clinic B for you. So now I would like you to open your eyes. Which clinic would you prefer to go? Clinic A or Clinic B? Yes, definitely Clinic B. Why? Yes, the intonation. And any other answer? Definitely the warmth, right? The warmth. Another thing? Yes, it was interactive, right? Yes, they asked for your opinion, they asked for your convenience, right? Great. So, when you stand in the shoes of a patient or a caretaker or a bystander, you know what you want to hear or you know what you want to be heard, right? So, that is what we are going to give our clients or customers. So, in case of Clinic A, all the information was shared. Everything was clear. It was a clinic, the doctor was busy, and the meeting was able to be scheduled on 4 p.m. It was okay. Everything was okay. But what was the problem? The tone, the intonation. But in Clinic B, every information was clear, but still they had this empathy, right? So, this is what we are going to deal today. So, to reach this empathy, it is very important that you should have both academic knowledge, language knowledge, that means linguistic competency, and certain skills. That means skills of your emotions, skills like empathy, communication, that's called soft skills. So, to be a better communicator, you need academic knowledge, that means theoretical knowledge, and then you need linguistic competency, and then you need soft skills. So, in the first 10 minutes, now let's work with this linguistic competency and academic competency. So, let's take academic competency. So, I want you to ask about something. So, have you ever heard about this thin slice theory? Let me have some random guesses. So, who is going to guess? What is thin slice theory? Yeah. As you guess, it's small pieces. Well done. Yeah, good guess. Yeah, it is minute details. Yes, fine. Minute details. Wonderful. So, as you have guessed, it's right. Thin slice theory is actually about a theory about judgment. That means when two people actually talk with each other over the phone or in person, the person who is listening often makes a judgment in the first 7 seconds. With the very shortest range of information that is available, with the very shortest range of gestures that is available, with the very shortest range of language that is available, we judge the person who is speaking to us, everyone. So, the judgment that a person makes in the first 7 seconds of the contact is called the thin slice theory. And we are going to crack that 7 second today. Okay, so as a health professional, it is very important to crack this thin slice theory. This 7 second is crucial for us. And how will we make sure that this 7 second is best for us? So, I have a card for you. It's called peak. What? Peak. P-E-A-K. I want you to repeat with me. How will you make your first 7 seconds the best one? Peak. Yes. Peak. What is peak? Any guesses? So before I say, I would love to have guesses from your side. So do you have any guesses? What is peak? Any guesses for P? It's an acronym. Definitely it's an acronym. P stand for one word, E stand for one word, A stand for one word, and K for another. What is P? Patience is a good guess. Yeah, you're close, but not patience. What is E? Empathy. Okay, that's also right and something that can be fit, but we are actually talking about the first 7 seconds when you talk to a person over the phone or in person. And that first 7 seconds has to have P-E-A-K in it. If you have this P-E-A-K, that is peak in your speaking, you become a very great communicator. So I'm going to tell you what it is. P actually stands for politeness. Okay? E actually stands for entity. And A actually stands for authenticity. And K stands for kindness. I'll explain. So, when the first conversation, first ring starts and you pick up the call, the first thing that you should keep in mind is it's peak time. So, what is P? Politeness. Start with a very professional, polite greeting. That is what P is for. Politeness is for professional greeting. Greet them. Always. Say good morning, good evening, sir, good afternoon. So this is what you have to initiate the conversation with. So what does P stands for? Politeness. Politeness means greetings. And now comes E. P-E-A-K. So what is E? E actually is for entity. The second sentence that you have to say is the organization's name. You have to state the organization name. That is very important. You have to state that you are talking from this particular organization. Okay? You have to say, yes, you received a call, you picked up the call and you say, good morning, this is ABC Clinic. You have to say the entity. So after greeting, say the entity. After greeting, say the entity. Entity means your organization's name. Okay? And then comes A. A is authenticity. Even if you're talking to an organization, you're talking to a person, right? So that person's name has to be known. So you can say your name or the name assigned to you by your institution. But you can also add your designation. So that is what comes with A. Okay? So what is order? P. What comes after P? E. E for entity. And what comes after that? A. A for great. A for authenticity. And the last K. K is kindness. That means the kindness actually denotes the pivot. That means you have to shift it and ask them what they need, or you have to offer them an assistance. So the K is kindness with assistance. That is, you can ask them, how may I assist you? This is a question. So this is the order that has to be there. I hope the order is clear for you. So to crack the first 7 seconds of your conversation with a client, what is the code that you have to remember? Peak, exactly, peak. And what does P stands for? Wonderful, politeness. What does E stands for? Entity. And what does A stands for? Authenticity. And what does K stands for? Kindness. Okay, so how will you ensure you're polite? Greet them. After greeting, name the organizations. Very good. After naming the organization, introduce yourself. Well done. After introducing, ask what you can do. Is it clear? Wonderful. So now let's practice this. How are you going to practice? Okay, so I have certain chits described over here. That means each node, each piece of paper has a name, an organization's name, a greeting, and a question arranged in different order. It's jumbled. You have to pick one and then arrange it in the order of peak, and then have to rehearse it with your partner. You were in groups before, right? So you have to go back to that group, then enact as if you are in a conversation with each other, and then take your cheat and practice this. I hope the activity is clear for you. Okay, so let's start. Okay, so I think the activity has been effective, and now you have mastered the first 7 seconds of your conversation call. And now comes the intonations. So before going to the intonations, we'll just sum up what we learned today. So it is not always the physical setting that matters in the healthcare industry. Sometimes the virtual and sometimes the telephonic conversations are also healthcare settings. And when you do that, it is very important that you should keep the warmth, because when you speak to a client, you are the brand. You become the voice of the brand. So to master that, especially to master the first 7 seconds of your phone call, you have to follow the formula of peak. Okay, so now let's wind up for today and we'll continue the session next day. See you all.